Chest pain is the most common symptom of a heart attack. Some people can have other symptoms. They can present with just really bad shortness of breath or pain in their back, pain in their jaw, neck pain.
The classic symptoms of a heart attack are chest pain under the middle of the chest bone or a pressure that's unrelenting. It usually happens with activity or stressful situations. There can be other symptoms like severe sweating or nausea, vomiting, but typically chest pain is the main presentation of a heart attack.
Nausea, vomiting can be a presenting complaint of angina. Again, more and more often we're seeing kind of fatigue and shortness of breath, especially in those who do not have the same kind of chest pressure pain. Again, those who are diabetic might have neuropathy and they won't feel the same kind of pain as others would, whose nerve function is normal.
There's a common misconception that chest pain is going to be something similar to pain that you feel throughout the rest of your body. The innervation to the heart just doesn't work that way. So a lot of times the pain is a pressure, it's a heaviness, and it can also be atypical in certain people in which they just experience either some vague discomfort or shortness of breath. So sometimes it can be hard for people to recognize that their chest pain truly is from their heart.
90% of the time, the symptoms are pretty much similar in terms of, if you're having a heart attack, it's still going to be chest pressure, heaviness, or tightness, or feeling like an elephant sitting on your chest.
A lot of men will have the typical symptoms of heart attack, but women can have different symptoms. A lot of times women who are having heart attacks may only be very short of breath.
A lot of times women might say they're just having some aches and pains in their chest, or that it's not the classic elephant on the chest down the left arm. It can be a lot more subtle, or even feel like it's more on the right side or into their back.
But again, it comes back to women knowing their bodies really well and saying if they all of a sudden have this onset of new profound fatigue that is associated with something like shortness of breath or a little bit of chest discomfort, that could be a sign of a heart attack.
But any of those sudden symptoms should be cause for alarm, and you should get yourself to St. Elizabeth as soon as possible.